Hi friends, we're talking about varicose veins. What causes it, how to prevent it, natural ways to manage it and medical methods to treat it. You know those bulging, twisted veins that sometimes show up on people's legs? We're going to explore what causes them and how you can treat them, both naturally and with medical help. So, what exactly causes varicose veins? Well, it all starts with the way our veins work. Normally, veins have these tiny valves that keep blood flowing in one direction, back to the heart. But sometimes, these valves can get weak or damaged. When that happens, blood starts to flow backward and pool in the veins. This causes them to swell up and become varicose. Now, you might be wondering why some people get varicose veins while others don't. There are a few factors that can increase your risk. Age is a big one. As we get older, our veins naturally lose some of their elasticity, which can lead to valve problems. Women are also more likely to develop varicose veins, especially during pregnancy when there's extra pressure on the legs. But it's not just about age and gender. Your lifestyle can play a role too. If you spend a lot of time standing or sitting, that can increase pressure in your leg veins. Being overweight puts extra stress on your veins as well. And if varicose veins run in your family, you might be more likely to get them too. Now, let's talk about what you can do about varicose veins. There are plenty of natural remedies you can try at home. One of the simplest is just to move around more. Regular exercise, especially walking, helps pump blood back up to your heart. If you have to stand for long periods, try to take breaks and move your legs. Elevating your legs can also help. When you're relaxing at home, prop your feet up above heart level. This makes it easier for blood to flow back to your heart. Some people find that compression stockings help too. These special socks put gentle pressure on your legs to keep blood moving. Watching what you eat can make a difference too. Wait, there is more, but do not forget to hit the like button if you have found this video useful. Thus YouTube will serve more videos to suit your interest on similar topics. A diet high in fiber and low in salt can help prevent varicose veins. And staying hydrated is important too. It helps keep your blood flowing smoothly. But what if these natural remedies aren't enough? That's where medical treatments come in. There are several options available, depending on how severe your varicose veins are. One common treatment is sclerotherapy. This involves injecting a special solution directly into the affected veins. The solution irritates the lining of the vein, causing it to swell and stick together. Over time, the vein turns into scar tissue and fades away. It's usually used for smaller varicose veins and spider veins. For larger veins, doctors might recommend a procedure called endovenous laser treatment. It works by using heat from a laser to seal off the problematic vein. The doctor inserts a thin tube into the vein and uses the laser to heat it up. This causes the vein to collapse and seal shut. Blood then naturally reroutes to healthier veins. Another option is radiofrequency ablation. It's similar to laser treatment, but uses radio waves instead of a laser to heat up and close off the vein. Both of these treatments are minimally invasive and can usually be done in a doctor's office. For very large, twisted veins, surgery might be necessary. The most common type is called vein stripping. The surgeon makes small cuts in your skin and removes the problem vein. It sounds scary, but it's actually a pretty routine procedure. Most people can go home the same day. Now, you might be thinking, do I really need to treat my varicose veins? They're not hurting me. And that's a fair question. For many people, varicose veins are mainly a cosmetic concern. But they can sometimes lead to more serious problems. If left untreated, varicose veins can cause aching pain and discomfort in your legs. Some people develop skin problems, like rashes or ulcers. In rare cases, varicose veins can lead to blood clots, which can be dangerous. But don't panic. Most of the time, varicose veins aren't a serious health threat. Still, if you're concerned about them, it's always a good idea to chat with your doctor. They can help you figure out if treatment is necessary and what options might work best for you. Let's talk about prevention for a moment. While you can't control all the factors that cause varicose veins, there are things you can do to lower your risk. Staying active is key. Regular exercise keeps your blood flowing and helps maintain healthy veins. If you're overweight, losing a few pounds can take some pressure off your veins. Avoiding tight clothing, especially around your waist and legs, can help too. And if you spend a lot of time sitting, try to take breaks to stand up and move around. Even just flexing your ankles and calf muscles while sitting can help pump blood back up to your heart. Now, let's address some common myths about varicose veins. You might have heard that crossing your legs causes varicose veins. But there's no scientific evidence to support this. The same goes for wearing high heels. While they might not be great for your feet, they don't directly cause varicose veins. Another myth is that varicose veins only affect older people. While it's true that the risk increases with age, young people can get them too. Pregnancy, in particular, can trigger varicose veins in younger women due to the increased blood volume and pressure on the legs. Some people worry that exercise will make their varicose veins worse. But the opposite is true. Regular exercise, especially activities that work your legs like walking or cycling, can actually help prevent and manage varicose veins. It's also worth noting that varicose veins aren't just a cosmetic issue. While they might not look great, they can sometimes cause real discomfort and health problems. That's why it's important to take them seriously and seek treatment if they're causing you pain or concern. Let's talk about when you should see a doctor about your varicose veins. If they're painful, warm to the touch, or the skin over them is red or discolored, it's time to make an appointment. You should also see a doctor if you develop a rash or sores near your ankle, or if a varicose vein starts bleeding. Even if your varicose veins aren't causing these symptoms, you might want to see a doctor if they're making you feel self-conscious or affecting your quality of life. There are so many treatment options available now, there's no need to just live with varicose veins if they're bothering you. When you do see a doctor, they'll likely start by asking about your symptoms and medical history. They might also do a physical exam and possibly an ultrasound to get a better look at your veins. This helps them determine the best treatment plan for you. Remember, everyone's situation is different. What works for one person might not be the best option for another. That's why it's important to work with your doctor to find the right approach for you. Living with varicose veins can be challenging, but there are ways to manage them. If you're self-conscious about how they look, compression stockings can help hide them while also improving circulation. Wearing loose, comfortable clothing can also help you feel more at ease. For pain and discomfort, over-the-counter pain relievers can help. So can applying a cold compress to the affected area. Some people find that herbal remedies like horse chestnut extract can help reduce swelling, but always check with your doctor before trying any new supplements. Varicose veins might be common, but that doesn't mean you have to just accept them. Whether you choose natural remedies, medical treatments, or a combination of both, there are plenty of ways to manage and treat varicose veins. The key is to stay informed, listen to your body, and work with your healthcare provider to find the best solution for you. Everything you need to know about what causes varicose veins and how to treat them. Whether you're dealing with varicose veins yourself or just curious about them, I hope this information has been helpful. Remember, your veins play a crucial role in your overall health, so it's worth taking care of them. Stay healthy, stay active, and keep that blood flowing. Preventing varicose veins from getting worse involves a combination of lifestyle changes and some practical habits. While varicose veins can be uncomfortable and sometimes unsightly, there are several effective strategies to manage and prevent them from worsening. First and foremost, staying active is crucial. Regular exercise helps improve blood circulation in your legs. Activities like walking, swimming, cycling, and yoga are particularly beneficial because they get your calf muscles working without putting too much strain on your legs. When your muscles contract and relax, they help push blood back up to your heart, reducing the pressure in your veins. Maintaining a healthy weight is another important factor. Excess weight puts additional pressure on your veins, which can worsen varicose veins. By losing weight, you can reduce this pressure and improve blood flow. This can be achieved through a balanced diet and regular physical activity. Elevating your legs can also make a big difference. When you elevate your legs above the level of your heart, it helps blood flow back to your heart more easily. Try to take short breaks throughout the day to rest with your legs elevated. You can do this by lying down and propping your legs up on pillows. Wearing compression stockings is another effective way to prevent varicose veins from getting worse. These stockings apply gentle pressure to your legs, helping your veins and muscles move blood more efficiently. Compression stockings are available at most pharmacies and come in various strengths, so you may want to consult with your doctor to find the right type for you. Avoiding prolonged periods of sitting or standing is also important. If your job requires you to sit or stand for long periods, try to take breaks to move around. Even simple movements like flexing your ankles and calf muscles can help keep blood flowing. If you have to sit for long periods, avoid crossing your legs, as this can further restrict blood flow. Choosing the right clothing can also help. Avoid tight clothing around your waist, legs, or groin, as it can restrict blood flow. Wear loose-fitting clothes that allow your blood to circulate freely. Similarly, wearing low-heeled shoes instead of high heels can help your calf muscles work more effectively, promoting better blood flow. Diet plays a role too. Eating a diet high in fiber and low in salt can help prevent constipation and reduce water retention. Both constipation and water retention can worsen varicose veins. Foods high in potassium, such as almonds, pistachios, lentils, white beans, potatoes, leafy vegetables, and fish like salmon and tuna, can help reduce water retention. Additionally, foods rich in flavonoids, such as onions, bell peppers, spinach, broccoli, citrus fruits, grapes, cherries, apples, blueberries, cocoa, and garlic, can improve blood circulation and reduce pressure in your veins. Gently massaging your legs can help keep the blood moving through your veins. Use gentle massage oils or moisturizers for optimal effects, but be careful not to press directly onto the veins, as this can damage fragile tissues. If you smoke, quitting can improve your overall vascular health. Smoking damages blood vessels and can exacerbate varicose veins, so giving up this habit can have significant benefits for your veins and overall health. In some cases, despite your best efforts, varicose veins may still worsen. If you notice increased pain, swelling, or skin changes around your varicose veins, it's important to consult a healthcare professional. They can provide additional treatments and interventions to manage your condition effectively. By incorporating these lifestyle changes and habits into your daily routine, you can help prevent your varicose veins from getting worse and improve your overall vascular health. Remember, small changes can make a big difference in managing varicose veins and maintaining healthy legs.